Medicare is complicated. Sometimes you're automatically signed up, sometimes you're not, and if you do it wrong, you get fined thousands. I'm going to break this down as simply as possible to give you a step-by-step instructions on how and when to sign up and what exactly to do if you messed up. When you turn 65, you become eligible for Medicare. Typically, you will be automatically enrolled in Part A if you or your spouse paid taxes for at least 10 years.
Initial enrollment period starts 3 months before.
Okay.
But do I need to apply or am I automatically enrolled?
If you start taking out Social Security at 65 or are already on early retirement, Part B is also automatic. A and B together make original Medicare. You can sign up or delay your Medicare enrollment during your initial enrollment period. This is a 7-month window. It starts 3 months before your 65th birthday and 3 months after. You can also choose a Medicare Part C or Medicare Advantage plan and or Medicare Part D for prescription drug coverage during this time.
Remember, the window is just 7 months. Miss this period, and the penalty clock starts ticking. Part B and D accumulate lifetime penalties that you pay once you sign up later. For Part B, it's 10% for every year you delay enrollment. This isn't a one-time fee. It's a permanent 10% tax on your Medicare Part B premium. For Part D, it's 1% every month you delay coverage. Let's put this into perspective using the estimated 2026 Part B premium. Here is what your premium would be for just Part B if you delayed it without other coverage. Now let's talk about common exceptions, and more importantly, the mistakes people make when relying on them. You can delay Part B without penalties if you have other coverage through your employer, or if you go the VA for your drugs, you don't need Part D, though you will be penalized if you stop using the VA and get Part D coverage later. Not all coverage counts as creditable coverage. For example, your employer coverage must be from an employer with 20 or more employees in order for you to delay enrollment without penalty. Always verify your coverage counts first. Crucially, COBRA and most retiree plans do not count as creditable coverage. If you're on COBRA and turn 65, your 7-month window is closing now and you must act.
So I'm currently leaving the Social Security office where I try to file some appeals. My first client technically did everything right. He just forgot to upload his wife's employer coverage that he had when he and his wife started Medicare together. So they tried to penalize him for roughly 15 years of not having coverage.
If you already missed your initial enrollment period, we can file an appeal, but we need to have a solid paper trail.
Another client that we're filing an appeal for was married 4 times, and her longest marriage was about 8.5 years, and they require 10 years in order for the spouse's work credits to count toward her Social Security. She wasn't able to work because she took care of a disabled child, and unfortunately none of the other marriages were 10 years long, and they don't accumulate together. If it's multiple, it has to be one marriage for at least 10 years for it to count. We're looking at some alternative options in our appeal to see if we can get them to cover Part A. If not, they're going to try and charge her roughly $6,700 a year for her Part A. But even though she's lived in the U.S. her whole life, worked on and off, and raised a disabled child, the paperwork wasn't right. And so they're going to either charge her literally 60% of her income on her Social Security check or just not give her coverage. So right now she's just going without. This is why it's really important that you don't miss your 7-month initial enrollment window. You make sure that you file everything properly so that you don't either lose out on coverage or get hit with a lifetime penalty, because really it's not easy to fix. We have to go through an appeal process with Social Security. There's really specific forms we have to fill out. We have to gather documentation, receipts of previous insurance or marriages. It's a lot easier to just do it right the first time than to go back and fix it when we're dealing with the government.
Finally, Utah has its own local nuances, including income-related monthly adjustment amounts, or IRRMA limits, Medicaid estate recovery risks, and specific MedSup enrollment rules you must understand. Subscribe and check out our other videos for more info on that. Check out our site for more information, or schedule a consult so we can make sure you didn't overlook anything.